Hello, I am Nicholas Davis, and this is my presentation on baseball injuries. My first injury is rotator cuff injuries, and it's when the tendon of a muscle in the rotator cuff group starts to tear away from the humerus. It is most common in the supraspinatus tendon. The mechanism of the injury is repetitive overhead rotation of arm with force, and over time, tears can develop. The anatomy and assessments. Injured most commonly in the supraspinatus, and tendon connecting the supraspinatus and humerus start to tear away and separate. To assess, patients have to lift arm above head, and there will be pain. In most cases, when rotating, there will be clicking in the joint, and muscles around the area will also atrophy. My second injury is a UCL sprain or tear. The sprain or tear of ulnar collateral ligament, which is on the medial side of the elbow that keeps normal relation between humerus and ulna. The mechanism of the injury. The more common the mechanism of the injury occurs over a long period of time with gradual stretching of the ligament or degradation of the tissue from repeated significant force across the elbow joint. The anatomy and assessments. A UCL injury is a sprain or tear of the ligament on the medial side of the elbow. The ligament keeps a normal relationship between the ulna and the humerus, and it is assessed with a valgus test, MRI, or X-ray. My last injury is medial epicondylitis, also known as golfer's elbow or baseball elbow. This injury is caused from overuse of the throwing arm and improper mechanics while throwing. The mechanics of the injury. This condition is a result of the over-twisting of the forearm or swinging in the throwing motion, which is done by every baseball player. The anatomy and assessment. It's the overuse of the syndrome in the flexor pronator mass origin. And to assess swelling will be looked for, a valgus stress test and provocative test will be looked for.